Hello and welcome to an interview on universal health coverage with Dr. Tunde Fakunle of CeSAHA. How do you pronounce the organization? Let me allow you to introduce the organization before I mix it up.
For sustainable access to health in Africa. We call it CeSAHA.
Okay, thank you so much. So we're having an interview today and we want to briefly talk about universal health coverage. This is a topic that I've been discussing with Dr. Fakunle, and there's still some things that I'm not clear about, and I'm sure you listening also or you watching will want to have some clarity on. So what better way to do that than to bring an expert in the field? So Dr. Fakunle, could you briefly just explain to me and to my friends listening, what is universal health coverage?
I think it's really very simple. Universal health coverage simply means that everybody, no matter your station in life, whether you are black, whether you are white, whether you are rich, whether you are poor, whether you are young, whether you are old, you have access to the healthcare you need when you need it without going into financial hardship.
Okay, so it's a healthcare for everybody, irrespective of race, background, without ruining you in common English.
Exactly. Some people call it health for all. Universal coverage.
Okay, health for all. And okay, so that's a nice concept. And I mean, sorry to put this way, I come across a lot of acronyms. So how is universal health coverage? I mean, what is the driving force behind it? I understand the concept of having healthcare for everybody, but what made this to be something that the UN is focusing on now?
Okay, it's really, I mean, if you go back into history, 1948, the World Health Organization, which is a UN body, enshrined universal health coverage into their constitution. They simply say that access to healthcare is a fundamental human right. That was in 1948. And some countries embrace that concept, and they have something very positive to show for that positive move. So, again, if you fast forward to 2012, in New York, the UN member nations came together again and came up with that historic resolution urging all member nations to embrace the policy of universal health coverage.
So it's something that the UN started in the 40s and then they reaffirmed it now. Okay, so let me allow you to continue, please. Go ahead.
Again, in 2015, in New York, the UN came together again and inserted universal health coverage into the Sustainable Development Goals. There are 17 Sustainable Development Goals covering environmental, sustainability, economic, and social issues. So universal health coverage is one of the key targets of Sustainable Development Goal number 3, which is talking about healthy living and well-being for all.
Okay, so the universal health coverage is part of the Sustainable Development Goals, and you mentioned 17 of them. So we're focusing on just universal health coverage for today. Is that correct?
Yes, which is a subset of Sustainable Development Goal number 3. But one thing about universal health coverage is that it is key to achieving all the other goals of sustainable development. If you don't get the universal health coverage right, it will be impossible, near impossible, to achieve the other goals. UHC holds the key to achieving the other universal health coverage, to achieving the other sustainable development goals as envisioned by the United Nations.
Okay. So it's clearer. So it's like the kingpin. I think we talked about this before, so that if you get this right, a lot of the other things now become easy. Okay. So the concept started in 1948. It was reaffirmed twice again, and it's part of the SDGs. But before we go into what you want to do about it, when I mean you, the people in the healthcare industry, the supporters, and the people that want progress, what has been the gain since UHC has been a concept with the UN? What has changed from the way things were done before? Can you just briefly give us some of the things that you've achieved using the universal health coverage system?
Well, I think it's the best way to understand the benefits of the universal health coverage is to look at countries that have embraced this concept and compare them to countries that have not. Countries that have embraced universal health coverage today they are the ones that we call them advanced development, advanced or developed countries of the world. So you can almost separate the countries into two parts. Those who have embraced universal coverage as a strategic imperative for their national development, and those who have not. So countries that have embraced it have far advanced economies. Their people are healthy. They have lifelong, very long life expectancies. They are very productive. There's peace. There's prosperity. These are all the things that universal health coverage brings to a society. So there's
okay. So you said that there's actually empirical evidence on the ground, and if you compare countries that have embraced UHC, and there are differences between them and people who have not embraced. And people like, can we narrow it down a little bit? Can you just give some specific examples?
Okay, for example, I live in Canada now. Canada embraced UHC in 1972 or thereabout. Canada is one of the G8, one of the developed nations of the world. The only developed country in the world that does not have UHC, as we know it, that does not have affordable care, is the United States of America, and that is what Obamacare was all about.
Ah, okay. So yeah, we can easily say, okay, how is health coverage in Canada? What are the results? And then compared with people like in Nigeria. Do we have universal health coverage in Nigeria, if I may ask?
Unfortunately, no. We don't have anything close to universal coverage in Nigeria. Nigeria is made up of about, let's say, 85 million people. Less than 2% of the population have guaranteed access to basic life-saving healthcare. The vast majority of our people don't have access to the healthcare they need when they need it. When you are sick, you have to pay out of your pocket to access healthcare. And
that is a really, really low percentage, 2%. Okay, continue, please.
Less than 2%. That healthcare is of that quality. So we have a major challenge in Nigeria. But it's not just Nigeria. Many of the countries in Africa, with the exception of
the same group. Okay, with the exception of which country?
Rwanda. Rwanda has done very well. Virtually almost all their people have guaranteed access to healthcare when they need it. Ghana is moving towards that direction. Egypt just declared about a month ago that within the next 5 years, they're going to have universal health coverage for their people. So Nigeria, we're still very far away.
Okay, so we have in Africa, we have Rwanda, we have Ghana, Egypt is coming up. So you said I'll put Rwanda at the top, Ghana, and then Egypt is starting a project.
Kenya is coming up.
Who else?
As a matter of policy, I've said that look, within the next 5 years, they also want to have universal health coverage. Ethiopia is coming up as well.
Okay, so we have Ethiopia, we have Kenya. Let's drill a little bit back home. And back home, I'm talking of Nigeria, not Canada. What do we need to put universal health coverage in place in a country like Nigeria? I mean, what are the things what is the framework that we need to put in place? What about strategy do we need to develop if we want to have universal health coverage in Nigeria? Because when you mention less than 2%, I mean, it's scary that less than 2% of the population have access to, the way you put it, basic health coverage. I thought you were even going to say high-level things, DNA sequencing, but you're talking of coverage. What are the things that we can put in place to make Nigeria have that?
Okay, excellent. I think the first thing is for the policy makers, the politicians, as it were, to really understand the strategic importance of universal health coverage to nation building, to nation development. So unless we have that, it will be difficult to have UHC. And again, if we embark on UHC, we build it on primary healthcare. Primary healthcare is a foundation of any nation's healthcare system. And right now, the primary healthcare in Nigeria is largely dysfunctional. I would say 80 to 90% of our primary healthcare facilities are in shambles. So the policymakers and even those of us, people like us, the stakeholders, must understand and embrace the concept of universal health coverage. Because if you don't have it, so many other things will not fall in place. For example, you are talking about no poverty by 2030, which is the Sustainable Development Goal #1. If you don't have universal health coverage, there's no way you can be talking about poverty eradication in Nigeria or anywhere.
Okay, so the politicians, the people who dole out the money, the people that set projects that should be done, they need to understand what universal health coverage is. Number one, that's your point. Then the doctors and the healthcare professionals who are going to take part in this process, they need to understand what it is. And then you brought up the point that the primary healthcare system, the primary delivery method system that we have, which is in shambles, to be, at least I've experienced that one, when you walk in and there's nothing in a primary healthcare facility, that has to be built up. So those are like the three key things that we need to put in place for us to even start talking about universal health coverage. Does that cover what you mentioned?
Exactly. You mentioned the policymakers, you mentioned the healthcare professionals, but you also need to talk about the beneficiaries, the people, the masses, those who are supposed to benefit from the programs. They also must be aware of what is going on. For this year's Universal Health Coverage Day that is coming up on the 12th of December, the theme is Rise for Our Right. That is the theme, which is in line with the fact that healthcare is supposed to be a fundamental human right, and that nobody should be denied access to that care when they need it. But as you all know, no right is guaranteed to anybody until you demand for it, or until you fight for it. So this gives us an opportunity to remind everyone that healthcare is a fundamental human right, and until you demand for it, until you fight for it, that right is not guaranteed to anyone.
Okay, so rights like there are fiction, or there are things that you put on the board till somebody actually reaches out and grabs and takes it. And that's what you're telling us to do. Can we talk about the upcoming Universal Healthcare Day? What day is it, and what program does your organization plan to do?
Okay, the day comes up on the 12th of December. And that 12th of December is deliberate, because you remember that it was on the 12th of December 2012 that the United Nations came up with that resolution of healthcare for all. So every year since that time, we've been marking what you call International Universal Health Coverage Day. So the plan for that is to embark on advocacy and to organize a joint educational workshop with the Rotary Club of Mississauga South in Ontario, Canada.
That's nice. So we can come and see you live. In parting, because we agreed we are going to keep this short. In parting, what are the gains? Can we just repeat the gains of universal health coverage? Why are we going through all these motions? Why are you spending your time? Why are you partnering with the Rotary Club? What will we gain when universal health coverage is implemented properly in a country like Nigeria?
Okay, I think first, we've already said that universal health coverage holds the key to achieving all the other sustainable development goals. So we talk about poverty, we talk about access to quality education, we talk about economic growth, we talk about productivity, we talk about smart cities, resilient communities. These are all the benefits that universal health coverage will bring. Universal health coverage will increase both the quantity and quality of healthcare, and makes it more affordable for everybody. It will ensure that vaccines are available as and when due to everybody. We talk about national immunization days, national polio campaigns. All this will not be necessary, because once you have universal health coverage, it works at the systemic level, and which is supposed to take care of all these other things. Many women are literally dying to have babies in many parts of the world. With universal health coverage, that will be a thing of the past. And we also know that universal health coverage has a potential to stop all the major killer diseases like tuberculosis, malaria, diabetes, hypertension, even cancer. universal health coverage is supposed to take care of that. You remember I think about 2 or 3 years ago, Ebola came knocking in West Africa. If we have universal health coverage at that time, Ebola wouldn't have killed so many people that it did, that it killed. So with universal health coverage, you have a resilient and robust healthcare system that will be able to take care of epidemics and pandemics. These are some of the benefits of universal health coverage.
Thank you so much, Dr. Fakunle. But before I let you go, I know you have another appointment. I just want you to lay out maybe, I want us to pick one example because somebody listening needs to, I like to see the link between concept and actual. Let's pick something like TB that we understand is a problem in Nigeria. People don't really understand what to do about it. Can you just, using that as an example before you go, what's the link between having good universal health coverage and reducing or eliminating a scourge like TB? Can you just lay it out for us?
Okay, that's that. If you take tuberculosis, for example, some of the associated factors that lead to TB, things like poverty, poor housing, and the poor health-seeking behavior. Okay, so if you have about 7 or 8 people living in one room, that's a perfect condition for spread of tuberculosis. And when you start coughing, before it becomes a very big thing, if you have access to healthcare, you'll not be afraid of going to the hospital. So if you have universal health coverage, it will affect in a positive way your health-seeking behavior. So you present to the hospital very early before it becomes a problem, so you can receive the treatment you need. That will also stop further spread of the disease from you to other people. That's one example. And that goes with several other conditions as well, that it impacts positively on the health-seeking behavior of the population. When you are sick, you go to the hospital in good time. You are not afraid, like now, because when you go to the hospital now, people have to pay out of their pocket to access healthcare. So that's
okay.
that.
I think that's very clear, and I can see the link, and people listening and viewing can see the link now between having universal health coverage where you don't have to pay out of pocket or sell your car to be able to take care of your cousin, and being able to walk into a health facility and getting very good treatment. I think that is clear enough.
Yeah, I think what happens right now is that if you are sick, you are more often than not, you just go to a nearby patent medicine seller and try to buy something. Something.
Okay. Thank you so much for your time and the explanation on your universal health coverage. I wish you and your group good luck, and not just good luck, but positive celebrations on the upcoming Universal Health Coverage Day. Can you just briefly tell us where we can meet you or meet the group before you go?
Okay, and that event is going to take place at 127 Mississauga Valley Boulevard in Mississauga, in Ontario, Canada. It will be web streamed to everybody all over the world, and we invite everybody to join us and be part of what is going on. Remember, healthcare is a fundamental human right, but that right is not guaranteed until we demand and we fight for it. So will you join us? Will you join the Healthcare for All movement? And let's push the universal health coverage agenda to the front burner. Will you?
Okay. Thank you so much. And if you want to follow up with what is happening towards universal health coverage, there's a hashtag you can use on your social media feeds. That is hashtag health for all, the 3 words. And then you can check the movement at healthforall.org. Healthforall.org as one word. Thank you so much, Dr. Fakunle, and see you.
Thank you, Ian, and talk to you later. Bye.